in that particular setting, I worked with students birth through 21. So I worked with infant and toddlers all the way to 21-year-olds. And many of them lived in a residential facility, so they were away from their families and they were cared for 24/7 by medical personnel and special service providers. So that's something that I will take with me into every experience.
That's really amazing. I had a similar-esque experience for my clinical fellowship, and something really big that it taught me is that it's not a bad thing to have a really difficult clinical fellowship. And it's not a bad thing to be really challenged because you take those lessons with you to every other experience you have after that. And I think that that really speaks to that having that extra challenge during your clinical fellowship year can actually benefit you for your whole career. And so that's really cool.
Yeah, I agree, and I have a lot of empathy and compassion for the CFs who are new and they find themselves in a challenging position because I remember every day for 2 weeks thinking, "I have to quit, I have to quit." But the other part of me was saying, "You can't quit, don't give up," you know? So, that was a valuable experience for me. I also worked in long-term care geriatrics, and I won't go a lot into that, but I'll tell you what I walked away with, and that was learning how to treat my clients and patients with dignity and the meaning of quality of life, you know, for them in those late stages of their life. That was really important. I loved it, and I learned a lot about the joys and the heartbreak of working with the geriatric population. So that in and of itself, I would have continued with it, but I also felt like I needed some hopefulness, you know, and that's when I went back to the school district working with children. But one quick thing, I worked with the head and spinal cord injured patients, and I love that as well. And I think that's where I learned to have confidence in myself and to bring to the table my expertise and to be confident because I was working with neurosurgeons and doctors and medical staff. And I felt like I was highly accountable, which I was, of course, working with very fragile populations. So, out of every experience in every population, there's those learning moments and those lessons, like you talked about, that we take with us into the next setting and the next experience.